Hi, good evening to everybody. I'm Dr. Philip McMillan. Thank you for joining me. I've been looking at COVID 19 since early 2020. Was involved in publishing a paper on a viral mediated autoimmune disease. And because of that understanding and that paradigm, I've been able to look at the pandemic and largely predict what's going to happen next. The big worry is that what's going to happen next is not pleasant. And that's largely because enough acknowledgement as to what the primary pathophysiology was has not been yet acknowledged. And critically, it means that there is limited understanding about what the impact will be going forward. So that brings me to this news story that this is why I'm sharing this. So this is a quick update on the news. And this is really about this BBC news article that was only published a few hours ago on the 10th of January 2024 about the COVID inquiry postponing vaccine investigation. And this is in the United Kingdom. The reason I'm highlighting this is because I think that I cannot express how critical it is for time in the context of understanding what has happened and to predict and to try and mitigate what could be coming on the horizon. So that's the reason that I am very, very concerned. So let's just take a quick look at the article, and then I'll share with you some quick ideas from a clinical point of view about what we call a duty of candor, which means that we have to share whenever there is a mistake that has been made. Clearly, this doesn't apply to politicians. But here is the article here. The COVID inquiry postpones vaccine investigation. And I said this is only about 4 hours ago, and that this was put up on the BBC News. You can see a picture of Boris Johnson with a vial, probably there, an Oxford AstraZeneca. And for those who are not aware, the UK has been conducting a COVID inquiry looking at the pandemic and what has occurred. And that is a very good thing. And I credit the system that was able to ask these questions of about all politicians. The prime minister had to come and sit in front of the inquiry. So nobody is able to get away without being able to explain their thinking and what was going on. So that is a very good thing. But we need more. That's the truth. So, in the context of the article, as we continue along, what they have said here, the COVID inquiry will not start hearing evidence about the development of vaccines and other drugs this summer as originally planned. In truth, I think that this summer was already too late. But within that framework, even within this summer, it's likely that these witness hearings will be postponed onto a later date, likely to be after the general election. I don't quite know why the election comes into this because this should be beyond the partisan politics. Granted, it could have an impact on a political party. And so, for their benefit, I guess they wouldn't want this to occur at this point. But this is not just about an issue of acknowledging that, gosh, we made a mistake. There are very serious clinical consequences if that mistake is not fully understood. So let's look at again what they had said with regards to the different phases. So the first phase of the pandemic was looking at the evidence in June 2023 in the planning of the pandemic, and the findings and recommendations are due to be published. The second phase was looking at the major political decisions taken after COVID 19 emerged. And then what was supposed to happen is then there is another module investigating vaccines and therapeutics, which was expected to start in summer 2024, but has now been postponed. And again, it's clear that this has something to do with politics because they have mentioned that they wanted this to occur after the general election. But as I have been saying over and over again, a lot of people think that this is just about, gosh, who made a mistake? Do they need to be prosecuted? From a clinical point of view, that's up to lawyers. But I mean, that's not relevant, in my view, for where we are now. People are still very sick. and they are unable to make progress with regards to managing their diseases without scientific acknowledgement. And that's why I think that this is so critical that it needs to be addressed very, very quickly. So here is what they were talking about. So the investigation in vaccines was looking in details across with jabs across the UK, including the setting up of the task force. It would also cover concerns around vaccine safety, including any suggested links between the jabs and heart issues. So, this is one of the things that I had highlighted recently. When we looked at excess deaths across the UK, there was a 44% relative risk increase with regards to heart disease or ischemic heart disease. And as I pointed out at the time, 22% increase in deaths at home, which was absolutely stunning, especially even in younger populations. So there are some very significant issues that need to be addressed. And as I keep on saying, from an autoimmune point of view, autoimmune disease takes years to present. It doesn't just happen. And so, within the context of what my research suggested, that severe COVID 19 was a viral mediated autoimmune response around the ACE2 protein that the virus uses to enter cells, suddenly, if you are having broad autoimmunity, what is going to happen in the next 5 to 10 years? So, my concern is about without scientific acknowledgement, there is no opportunity for mitigation. Additionally, without scientific acknowledgement, there is no opportunity from a clinical point of view for the duty of candor. And this is now about what the CQC has here. So, this is the duty of candor, which is in place for clinicians, where they have to, it's here, the duty of candor is a general duty to be open and transparent with people receiving care from you. And so, if there was harm that occurred, without scientific acknowledgement, the medical community is not able to implement the duty of candor, critically, to acknowledge error. And then, additionally, they are not able to start that process of trying to find solutions. To give it context, I've been researching long COVID now for almost 2 years. And this is hard work. It's not easy. It's not quick. And so every day, every month that is delayed with regards to acknowledging these things and trying to find solutions that mitigate is putting patients at risk. That's the reality. You can argue all you want about the politicians, but who is at risk are patients, and who has to pick up the tab are the health sectors across the world when people are getting sick and we don't fully understand the mechanism. So we have a very serious situation on our hand. It does seem that there is no intention to acknowledge the elephant in the room. One of the problems with delaying this kind of investigation is that it makes it harder and harder to make any clear links to what is going on. Now, that may be deliberate, but it's not of benefit to the general public. And that I would hope that at the end of the day, whatever is going on, we finally have leaders and politicians who recognize that the priority and their responsibility is to protect the public that was and they were elected to serve. Let's see what happens next. But based on the trajectory as to what's going on, it doesn't look good. And the longer it takes for acknowledgement, the less chance there is for mitigation. Have a great evening.